Good morning, everyone. Myself, Samir Idrisi, roll number 58 from Dr. Ullas Patil Medical College and Hospital. My topic is sedative and hypnotics. Let's start. Uh, First of all, let me tell you what is sedative and what is hypnotics. Hypnotics is the agent that produces sleep or the drug which is used normally in insomniac patient. A patient which cannot sleep at night usually find difficulty in sleeping. And sedative is the drug which is used for the calm the patient, it to relieve the tensions and anxiety, due to which a person relax and drowsiness without inducing sleep. It does not induce any sleep. uh, what are the drugs? Sedative hypnotics had benzodiazepines, barbiturates, non-benzodiazepines, and other CNS depression. Uh, let's study one by one the barbiturates and benzodiazepines. The first one is barbiturates. We will study introduction, classification, mechanism of action, pharmacology action, interaction, and why barbiturates are not prefer over benzodiazepines and their uses, adverse effect, and what is barbiturates poisoning. So let's see. First of all, let me introduce the barbiturates. Barbiturates are substituted derivatives or barbituric acid or malonic urea. Barbituric acid is such as hypnotic but compound which allele or arise substitution on C5. So let's see classification. Classification, it has three types: long, short, and ultra short. In ultra short, the drugs come under is thiopentone. The short acting is pentobarbital and butobarbital, and long acting is phenobarbital. How it acts? Normally, it acts through two neurotransmitter. First is GABA and second one is glutamate. GABA is a inhibitory and glutamate is a excitatory neurotransmitter. And how it work, let's see. First of all, what is GABA receptor? GABA receptor is a 5 pentavalent which has 2 alpha, 2 beta, and 1 gamma receptors. And it directly coupled with the chloride channel and centralized. There is a one chloride channel. There's a chloride channel and around which the 5 receptors are there present. What is normally happen? Normally the GABA receptor activates and will increase the inflow of chloride into it, and the hyperpolarization occurred and inhibit the action. Normally chloride is used for the inhibition. Now let's see what is how mechanism of action barbiturates work. There is a 3 mechanisms it works. First of all, the GABA facilitatory action. What is it? Normal barbiturates binds to the GABA receptor on their alpha and beta subunits, increase the affinity of GABA receptor, which increase the lifetime of chloride channel opening, cause the GABA to facilitate its action. Normally the chloride come into the chloride channel, and the chloride channel hyperpolarization occur and the inhibition take place. So basically the GABA facilitatory action helps. It works on the GABA receptor and facilitate the chloride entry. It is basically barbiturates work on the GABA receptor. The second one is GABA mimetic actions, in which there is a high concentration and barbiturate directly activates the GABA receptor. In previous one, we see the GABA receptor, the barbiturates act on the GABA receptor, and here the barbiturate directly act on the GABA receptor, which increase the chloride conduction, due to which the chloride flow increases. As you know, chloride is an inhibitory. The hyperpolarization occur and the inhibition take place. And the third one is barbiturates inhibit. Barbiturates inhibit the glutamate induced depolarization through AMPA receptors. Let's see further. The action on CNS. Barbiturates act on CNS. It first of all, it shorten the sleep latency. When you go to the sleep, the time जब तुम सोने के लिए गए से सोए, उसके बीच का जो टाइम इंटरवल होता है उसको बोलते हैं फॉल अस्लीप. ठीक है. उसको शॉर्ट कर देता है, मतलब तुम जैसे ही गए उस फटाक से तुम्हें नींद आ गई। स्लीप लेटेंसी शॉर्टेन। फिर सेकेंड है स्लीप ड्यूरेशन इंक्रीज, स्लीप का जो ड्यूरेशन है विच इंक्रीज हो जाता है। एंड स्लीप आर्किटेक्चर, देयर इज़ अ NREM एंड REM ऑन योर नॉर्मल स्लीप in which REM and stage 3 and 4 of NREM will decrease, and it confuses unsteady awakening, night awakening, hangover. Mostly when we wake up at the morning, we feel like dizziness, short of mood, morning irritations. Barbiturates only short-term memory. You don't even know few small events, and no energizing action. It does not decrease any pain. Anti-conversion property. Let's see interaction, how barbiturates interact with other drugs. Warfarin, steroids, tolbutamide, griseofulvin, chloramphenicol, theophylline. It is several hepatic macrosomal enzyme and increase the rate of their own metabolism as well as that of many other drugs. Okay? There are some drugs which increase its metabolism. Additive actions with other CNS depressant like alcohol, sodium valproate increase plasma concentration, phenobarbital decrease absorptions. What is uses? Normally, we do not prefer barbiturates. We normally prefer benzodiazepines, but there are some barbiturates which we are now using, like phenobarbital. Phenobarbital come under which class? Correct. Long acting. So thiopentone used as an anesthesia, and no other barbiturates are normally used due to some very side effects and other things. Let's see what is adverse effect. Drowsiness, as I said earlier, there is a hangover in the morning. Sleep disturbance, as is decreases the REM, third, fourth stage of the NREM, and REM also decreases. Paradoxically, excitement, respiratory depression. It may cause other adverse effect. Drug automatism. It is very interesting, in which if you take a pill at around 11 o'clock at night, after 1 hour you forgot that you had taken that pills, so you again take that pills. So you are taking 1 hour, so you are taking that pill 1 hour again, then again, due to which the overdosing happen, and it lead to some adverse effect as we have studied earlier. Let's see barbiturates poisoning. It is the most used poisoning nowadays. As you know, many children are suicidal purpose use barbiturate. They eat lots of sleeping pills for suicide, in which the unconscious happen, respiratory depression happens, circulatory collapse, and ultimately shock and lead to the death of the person. How will you manage? Whenever a patient came to you with the barbiturate poisoning, gastric lavage, emetics, if it taken earlier, gastric lavage, airways, IV fluid with dopamine, and alkaline diuresis. Mostly the barbiturates are acidic in nature, so we use alkaline diuresis, or hemodialysis also is the last option if renal is not working properly. Remember, there is no specific antidote for barbiturates. Okay, let's see what is benzodiazepine. Benzodiazepines has variety of action: hypnotics, anxiety, anti-convulsion, or there is one common name, as you see, diazepam. Diazepam came under hypnotic, anti-anxiety, convulsion in all three of them, and rest are like alprazolam, flurazepam, nitrazepam, temazepam, triazolam are the other drugs. How it mechanism of action of benzodiazepine is only GABA facilitating effect only. The barbiturates acting by three mechanisms: GABA facilitatory, GABA mimetics, and the GABA inhibitory. But the benzodiazepines only work through the GABA facilitated effect, due to which other side effects are very less in benzodiazepine. That's why we use benzodiazepine over barbiturates. Let's see how it works. Normally, benzodiazepine bind to the accessory site on GABA receptors, which is alpha and GABA. In barbiturates we see alpha and beta, and here we see alpha and GABA, which increase the affinity of GABA receptor to GABA, more frequent opening of fluoride channel, increase frequency not duration. It increase, अगर 1 मिनट में बारबिट्यूएट्स क्या करता है कि 1 मिनट को एक्सटेंड करके वो 1 मिनट से बढ़ा देता है टाइम को, पर ये 1 मिनट को 1 मिनट ही रहने देता है, पर उसमें जो खुलने का टाइम है उसकी फ्रीक्वेंसी बढ़ा देता है. फ्रीक्वेंसी इक्वेशन इंक्रीजेस नॉट ड्यूरेशन. This is the major difference between barbiturate and benzodiazepines. GABA facilitative effect. Chloride enter the cell, hyperpolarization occur, and inhibition take place. Things which you are need to remember is benzodiazepines facilitate but no GABA mimetic. The benzodiazepine only work through. It does not show mimetic action. Inhibitory action is only show facilitatory. Okay, and barbiturates have both facilitative and mimetics. Benzodiazepines are more safer than barbiturates, and barbiturates do not require GABA activator to the receptor, hence not safe. Okay, action on CNS. It causes sedative, hypnosis, and anti-convulsion action, as we see. Anterograde amnesia, muscle relaxation, analgesic, antidepressant, lots of uses of benzodiazepines. Advantage over barbiturates. Let's see. First of all, benzodiazepines have high therapeutic index, and hypnotic doses does not usually endanger life. Benzodiazepine never make a patient lead towards a death, but barbiturate hypnotic dosage does not affect respiratory cardiovascular function. Benzodiazepines have practically no action on other body stream. Benzodiazepine less disorder of sleep architecture. Benzodiazepines do not alter deposition of other drugs. They have lower abuse and liability. Specific benzodiazepine antagonists are flumazenide. It is the antagonist of benzodiazepines. Uses. It is used for the anxiety, insomnia, epilepsy, pre-anesthetic medication for procedure like endoscopy, muscle spasm and spasticity, tetanus, acute alcohol withdrawal, alcohol addict as substitution therapy, psychosomatic disorder also. What are their adverse effects? They may be tiredness, somnolence, ataxia, headache, vertigo, dizziness, impaired judgment, prolonged effect, and hangover, tolerance, dependence. Used for more than 2 weeks, need gradually tapering. So we need to remember few things like GABA is a pentavalent in which centralized chloride channel, 2 alpha, 2 beta, 1 gamma. Barbiturates act on the alpha and beta side. Benzodiazepine act on the alpha and GABA sides. Let's solve some MCQs. First of all, hypnotic drugs are used to treat. Other MCQ like ultra short acting barbiturate is the hypnotic benzodiazepine which has the shortest half-life is. So thank you everyone. Let's end up our section over here. It's my first explanation. I hope you understand.